Good morning, I'm Adam Sexton. Thank you for joining us. Hospitals are on the front lines of this COVID-19 outbreak, and they are already dealing with a lot of concerned Granite Staters, both confirmed cases and people worried about possible exposures. This morning, we'll discuss the local hospital response with Dr. Greg Baxter, President and CEO of Elliott Hospital, and Alex Walker, Executive Vice President and Chief Operating Officer at Catholic Medical Center. Gentlemen, thanks so much for being here this morning to provide us some information on what's going on. Dr. Baxter, let's start with you. How is the Elliott responding right now as we see the number of cases start to increase?
It's a great question. So the Elliott has, much like CMC, a large presence in the community. We're an influential organization with lots of employees, and we have an outsized responsibility in this community. We start with education, information, and using our existing preparations and ramping those up, making sure we can meet all the routine healthcare needs that we so adequately do 24/7, and then meeting this new response and challenge. We've done a lot of work to stand up local infrastructure and really tie that into city, state, and federal guidance and guidelines from them.
All right. And Mr. Walker, are you expecting an influx of patients in the days and weeks ahead?
We will certainly be seeing and hearing from a lot more patients, mostly around communication. You know, people have questions, they're anxious, and our job as a healthcare provider is to not only treat them when they need treatment, but to communicate effectively with them so that they, have a sense of calm and lessen their anxiety in the days and weeks ahead, because it's going to get a lot busier for everybody. As we sit here this morning, things are going to be different, later today, and they'll be different still on Saturday and Sunday and into next week. And what we're doing every day, working shoulder to shoulder, with local, state and federal officials, is to understand what's happening, to coordinate our efforts, not just with those officials, but with folks like the Elliott. Our emergency management personnel are working arm in arm to make sure that our patients, our communities understand what's happening, and that we're communicating with them effectively so that they can get the care and treatment if and when they need it.
Let's talk about capacity. In any flu season, it's already going to be busy to begin with, and now this is here on top of it. Dr. Baxter, is there a concern that at some point there won't be enough beds?
Well, it's always a theoretical concern. One of the issues we have across U.S. healthcare is that we have just enough capacity to meet the current needs. We have a little bit of surge capacity. To really mobilize additional surge capacity, I think Alex and I would both tell you that there are things we can do. They would cause disruption on normal operations and really a move to more of an emergency management mode. So our healthcare systems have that capacity. Again, you've got to balance appropriate, proportionate response to what we see in our community. We're not at a place where we've made that step yet, but we're continually eyeing that to make sure we're meeting the needs of the community as it currently exists, the patients who are waiting for care or need urgent care, as well as the people who now perhaps with, if there is an increase in incidence of the COVID-19 in our communities, what needs will they have? So it's sort of a flexing of our current capacity. Right now, the big concern for us will be staffing. So as societally, we're looking at closing various things. Clearly the school systems and how they will impact our ability to staff units with a current volume of patients plus more. So we're going to be working together, and I think I'd touch base on something Alex mentioned. There is a camaraderie amongst the healthcare systems, both in Manchester and across the state. We are lucky that we share a lot of information. We always have a shared purpose, and that's a real strength for a state like ours.
Can either of you give us a sense of how close Manchester is to capacity right now in terms of beds?
Oh boy, we, at Catholic Medical Center, we have been busy, just generally speaking, for quite a long time. And so, as we see more patients over, the coming days and weeks, we're making plans to be able to accommodate those patients. We've stood up our incident command center probably 10 days ago, just in anticipation of what might be, not what will be, but what might be, and so that we are doing the appropriate level of planning, planning for the worst, hoping for the best.
I think a lot of people, read widely about this, and people see what's going on in Italy, where the system is suddenly being overwhelmed. Is that within the realm of possibility here? I mean, certainly this is a pandemic, so it has to be on the map at some point. But could we get to that point here in New Hampshire, do you think?
So I don't know the specifics of how those local communities responded in the initial stages. I can say, and I think it's universally known, that there are questions about our understanding of how widespread COVID-19 is, because we haven't had the testing that we may have really indicated that and helped us understand it. What I will say is what you're seeing right now with actions taken by numbers of organizations, as well as I think both of our health systems, at trying to do social distancing to really flatten the trajectory. What happened in Italy was the rapid rise of cases and the acuity, so the patient illness severity went up so fast that those local systems could not accommodate. You learn from that, and you say, okay, what would we do differently, and what have we learned in the last 2 weeks about their experience? So all of these really dire predictions could be in the offing. I have confidence that we will work very hard to change current things and mitigate what we can to have a different outcome.
And Alex, does there come a point when that curve starts to go up, should certain people not come to the hospital or come to the ER? Will there be sort of a plan to divert certain patients so you'll be taking care of the most sick rather than people who might be on the edge?
Yeah, and we're starting to do that now. I mean, all hospitals, around the state and at CMC, we are taking steps and will continue to take steps over the next several days and into the weeks ahead to limit access. So we are limiting access to the hospital starting today. We're going to be screening folks, as they come into, a couple of different access points within the organization, and it's all in an effort to keep people safe, to flatten that curve, as Dr. Baxter mentioned, so that we do not find ourselves, in a week or 10 days or 2 weeks in a situation like you've seen elsewhere in the world. And there are lessons learned there, to be sure, just as there are lessons to have been learned or to learn from, what's happened in Seattle. On the West Coast, and that's what we're doing, every single day. Our incident command center at CMC meets twice a day, 9 o'clock and 3 o'clock, and I'm sure there's a lot of meetings in between. And I'm sure the same's happening at the Elliott. Just came from a meeting with the city this morning to talk about next steps there. So it is undoubtedly all hands on deck for everybody at CMC, and so folks, in and around Manchester and in New Hampshire should know that your local hospitals, have done the planning, are approaching this with a sense of urgency, but not panic, and a little grace under pressure, right? And I think we can state pretty confidently that given the planning we've done, we got this, and let's just take it one day at a time. But folks are going to have to be prepared, for changes. And we need to be nimble about, making decisions when they need to be made and not delaying on decisions that need to be made.
Doctor, you mentioned testing and the struggle that's been there for the CDC to provide that extensively on a national basis. What's happening right now if somebody calls the Elliott or CMC and asks, hey, I want to be tested, what can I do?
So that's a great point. And what we're asking people to do is actually do just that, call first. Right? So in that call, we're going to determine their relative risk, what their exposure is, and give them guidance. Guidance can mature to the point that the guidance is you have low risk exposure, but you sound like you might have a respiratory illness, and you may just be more comfortable recuperating at home, and then guiding them should they seek acute care and how to do that. That allows the staff at both our organizations to be prepared, to have the personal protective equipment so they can go out, meet with patients, collect the specimens should they need to be tested, assess them clinically, and then route those testing right now to the state laboratory. The turnaround time is about a day or two. As yet, we've done more testing recently, and we are awaiting guidance from the state and federal government whether those testing strategies will be liberalized, and perhaps by the time this runs on Sunday, those things may be evolving and changing, in which case we'd be doing more testing as the criteria changes. And I would just caution the audience that if that is an occasion and we do more testing, we will diagnose more cases. that may or may not mean that COVID is spreading to the degree the numbers change. So the numbers and the actual prevalence of COVID in our community, we may have some catch up to do as far as that diagnostic rate.
And Alex, describe for us, as we've kind of alluded to before, some of the people who are at most risk here are the healthcare workers themselves. What are the steps being taken to protect them, and then the plans that you have should you see more and more of your own staff become ill?
Yeah, so, as we, plan every single day, making sure that we have, the proper equipment for our staff, making sure that, patients are calling in, right? We're not having folks show up at the hospital or at a primary care office or in an urgent care location if they don't have to. And, making sure that, proper, we keep saying it, proper hand hygiene, right? Making sure that, everything is completely disinfected all the time. I mean, those are just the basic blocking and tackling of, infection prevention. But making sure that the supplies are on hand, gowns, masks, other equipment to keep folks safe, and talking with the supply houses and vendors and everybody in that supply chain to make sure that we're not at a point several weeks from now where resources become either ungettable or very, very scarce.
And Dr. Baxter, I do want to follow up on one thing you said about infrastructure. In standing up more capability there to treat more people, are we going to see tents, or like in Washington, they bought a hotel? What's going to happen like that?
So interesting you asked that. Yesterday afternoon, our incident command, much like Alex's organization, we stood up that process to be as nimble and agile as we could. There was a request to set up and stage our tent, which we use for some surge capacity. And we did that in the middle of the afternoon, and by 6 p.m. we actually started seeing patients. There were about a dozen patients who had presented for testing, and luckily, we're happy to report we were able to use the tent, not occupy our emergency department, and displace other patients who sought care with us. And all those patients had an illness severity of whatever virus it might have been. It could have been COVID-19 or not. They were all safely discharged home to self-quarantine until the test results were back. So I think both organizations can take on that responsibility. Importantly, when Alex mentioned, we're coordinating tightly with the city, and we have hopes that we may be able to stand up other ways of testing which allow the acute care hospitals to take care of the higher severe illnesses and allow the less ill but still concerned citizens to hit a different location to spread that out a bit.
All right, Dr. Greg Baxter and Alex Walker, thank you so much for your work and coming here to talk about it too.
Great.
Thanks for your
very
time.
much. Thanks.